Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. I am excited to be sitting here today with none other than the VP of Content and Programming at the HIMSS Global Health Conference and Exhibition, going to be taking place in March of 2025. None other than the wonderful Joanne Klinedinst. Joanne, thank you so much for joining us today.
Oh, it's a pleasure, and thank you for having me.
And so I've been following you for quite some time on the LinkedIns. You put out fantastic content. It's really nice to see what you do with the conferences over the last couple of years. Talk to us. Let's jump right in. What is going to be special about HIMSS 25?
Well, we have a fabulous show at HIMSS 25, and the pillars of a HIMSS Global Health Conference and Exhibition are surrounded by education, exhibition, and networking. So from an education perspective, we have many different venues that are welcoming world-renowned speakers, beginning with our keynote platform, which is threaded very purposefully around technology, around cyber, and of course, around leadership. So we're very, very excited to welcome Samsung Medical Center as they talk about their digital health care journey. Also, retired captain of the U.S. Army, Paul Nakasone, as he speaks about cyber, AI, and beyond, and all the challenges and the risks and the opportunities. And then we end the conference with a conversation with Simone Biles. And we are head over heels to welcome Simone Biles, as she is not only a mental health advocate, but also is just an incredible role model for resilience, perseverance, and all that she does in her aspects, from achieving many gold and U.S. gold and Olympic medals.
Yeah. It sounds really exciting, and definitely some great highlights. Let's take a giant step back, Joanne, and talk about conferences, healthcare conferences in general. Following your content on LinkedIn, it's very clear that this isn't just a job. This isn't just a position. You're really passionate about it. It's a very important part of connecting healthcare are these conferences, and they are a dime a dozen. There are a million conferences, and somehow HIMSS has managed to stay at the top of that ticket, and really the forefront and premier conference for healthcare. So talk to me a little bit about your specific passions for healthcare conferences and what you've seen it do to healthcare.
Yeah, so amplifying that voice of the clinician or those who work alongside of the clinician has really been my life's passion. I worked in a hospital IT department very early after graduating from college. HIMSS was my professional society. So I literally grew up and earned all the awards and all the accolades that we and I encourage others to do. So it's a passion. My passion is educational programming and content, but we also have a phenomenal exhibition. We welcome exhibitors to our event. We have pavilions that speak to many different topics where attendees can do a deep dive into whether it's AI, whether it's cybersecurity, whether it's government pavilion. And then we have networking events. So we celebrate the health information and technology professional regardless of their career focus or their aspirations. So we go from the emerging professional with zero level of experience in healthcare all the way through the senior executive with 25, 30, and more years of experience. So I believe that is a key differentiator. And then I'm going to talk about content. our content that appears in the HIMSS Global Health Conference and Exhibition, there's a mix of how it's created. So we have some content that is curated, meaning me and my staff, we identify opportunities for topics. So we create those. We also have peer-reviewed content, and that's where the power comes in with the HIMSS Global Health Conference and Exhibition, because you have those who respond to a call, who say, I want to speak. And those who want to speak, they've taken great pains to identify what their topic is. They describe their topic. They align it to learning objectives. And there's a story that they're telling. And then that's only the beginning of the process. Then we have several hundred reviewers that look at this content, review this content. And then there's also the HIMSS Global Health Conference Education Committee that really digs down deep and scrutinizes those proposals that come in. So that, from a content perspective, is really remarkable. And this sense of pain, if you will, and just finding the best of the best content is really what I believe separates a HIMSS Global Health Conference from others. Not to mention that we do, at HIMSS 25, we will offer 16 different types of continuing education. That's both clinical and non-clinical. And that's really difficult to do, but our content is all CE eligible. And in order to do that, we have to follow guidelines. We have to follow ACCME guidelines for clinical CE, as well as nursing, and then we have non-clinical CE as well. So these things are truly differentiators in what we do at our conference.
Yeah, and that kind of really leads me into my next question, because like I said, conferences are a dime a dozen, but not the HIMSS Global Conference. This is I think you're expecting somewhere around 35,000 people to attend. It is a massive, massive operation. What are some of the unique challenges, and then maybe some of the unique excitements about dealing with a conference on such a large scale?
So whenever you have a public gathering of 30 to 35,000 people, you need to have contingency plans. So we do a lot of work in the background to make sure that our attendees, that the challenges, should challenges occur, we're prepared. So we do a lot of work in the background. We do a lot of work to ensure that the experience is a very relevant experience. So what we bring to HIMSS 25 will be relevant. We take a lot of time in crafting those experiences, regardless of where they appear, whether it's education, exhibition, or networking.
Yeah. Are there any fun stories that you're allowed, that you can share for talking about?
Oh, I have lots of stories. So, so one of the fun stories, this happened a few years ago. I was moderating a Views from the Top. So that's one of our types of educational offerings that we have. So I was moderating a Views from the Top, and I had been with HIMSS for quite a while. Well, there was a gentleman in the audience who I worked with as a student intern with his wife. And he came up afterwards and he greeted me, and it was like, oh my goodness. So that's probably one of my favorite stories, that you just never know who will appear at a HIMSS, HIMSS 25. And then my most recent experience, I was at the Delaware Valley and New Jersey HIMSS combined conference, and I met a second generation HIMSS member.
Really?
So that was a first. So there's a whole community out there of second generation HIMSS members, and we will find them. So, and it's great to know that, some of them are at global conference.
That's fantastic. Joanne, one of the gripes that I have often with conferences is that healthcare can be a very boring topic, especially when you're trying to program it around around CMEs. It can get very technical. It can get very boring. It can be very government, regulation topics and billing topics, and but a lot of people seem to mistake that with the people in healthcare being boring people as well. And so the programming often is very
Not where
boring.
I worked.
Exactly. And so but what I see from the HIMSS global conference and exhibition is that you definitely, I mean, one of your highlights was, is Simone Biles. You guys are always thinking out of the box. You seem to be going definitely in a different direction. What's your mindset about the balance of hardcore education, but also making it kind of entertaining, making it fun, making it a place that people want to be, not somewhere that they have to go?
So thank you for asking that, because we do have quite a few changes this year. So one of the first changes that we've done is we put a midday break. We typically would go from 8:30 in the morning till 5 o'clock and sometimes even 6 o'clock at night. So now what we've done, we have a midday break for 90 minutes. So attendees can, relax. They can go to the show floor. They can get something to eat. Regardless, there's a break. So that will happen Tuesday, Wednesday, and Thursday. And then we've also right-sized our educational settings. So instead of the cavernous room you may have expected of years past, we've right-sized that so the setting is a little more intimate. We also have multiple different types of formats. We have some new formats that we've introduced this year. One is called the fishbowl format. And what that is, that can occur in either a closed or an open manner, meaning if it's open, someone can literally come to the stage and join in the conversation. If it's closed, there will be people just sitting on the stage in the round talking about a particular topic with a facilitator. Then we also have 30-minute sessions. We have 60-minute sessions. We have point counterpoint, best practices, and case studies. So a little bit for everyone. But the density factor, if you will, healthcare is critical. I mean, the things that clinicians deal with at the bedside, there's, sometimes a matter of a life or death situation. So those experiences that clinicians have and health IT and health information technology professionals that they can bring and willingly share with others is just remarkable. I just remark year over year at the types of sessions that we have and the willingness to share tools and resources and be available and answer questions. So this year, when you talk about fun, we have a session on pickleball. And that, if you recall, that was one of my first posts about the HIMSS 25 content. But this is a session about leveraging the patient notes and finding clues as to injuries in pickleball. So that's just one example. We do encourage our speakers to quote unquote think outside of the box, to have fun. We've seen point counterpoints just within a session, the way a session is delivered. We have interactivity. So we do have things that we ask our speakers to do to really lighten up the content.
Yeah. Are you doing any kind of like comedy or music or anything that's not specifically healthcare, but is just entertaining?
So our opening reception, the place to be. There'll be a lot of fun things going on there. We have a phenomenal operations team. They are the party planners. There's no better party planner than an events and logistics person. So that is our opening reception. And prior to that, we're going to focus on a celebration of HIMSS chapters, communities, and collaborators. And there will be information tables available outside of the venue for the opening reception. And that's probably one of my favorite places to be, because you can see these chapters and communities and committees all come with themes. So if you're from the cheddar cheese region of Wisconsin, you may see a cheese head. If you're from the bays of the from the shores of the Chesapeake Bay, you're going to see crab chips and crab fries, and it just goes on and on. So it's very regionally themed globally, because HIMSS does have communities outside of the U.S. as well. So,
right, you've been doing Europe for a couple of years.
Yeah, that's one aspect. And then on the exhibition floor, there's events, there's happy hours, and a lot of fun things going on the exhibition floor as well.
That's awesome. Where's closest to me in Pennsylvania? What's the closest?
I'm sorry?
Where's the closest HIMSS chapter to me in Pennsylvania?
So Delaware Valley HIMSS is the southeastern region. There's also a central Pennsylvania. So that's, Harrisburg region. And then there's western Pennsylvania as well. So you have three to choose from. But then across the river in New Jersey, there's a New Jersey HIMSS as well. And New York, if you want to go to New York. And sometimes these groups all come together. Yeah.
Yeah, I'm not too far. I'm like 2 hours. I'm 3 hours from either of them, New Jersey, New York. And, you talk about finding a second generation HIMSS member. Why do you think, from the member perspective, why do you think members keep coming back, and specifically to the global conference?
So a global conference is a welcoming event. It's a welcoming event. There is a lot of innovation going on. We have an emerge experience that is focused on innovation. And this is really, really important. So there's always something new that's going on at a HIMSS Global Health Conference and Exhibition. So the Emerge Innovation Experience, for example, we don't care if you're new to healthcare or you've worked in healthcare a long time. An idea is an idea. So celebrating those ideas, giving attendees an opportunity to continually professionally develop is really, really important as well. So the various venues that we do have, we have a professional development campus that's modeled after a quad in a university setting. It even has a town clock. We have a bookstore by Taylor and Francis, and where attendees can browse books, purchase books, either electronic version, or they can walk away with a paper copy. You can earn continuing education across those 16 types, as I've mentioned. But it's the energy and it's the passion that I see, and really celebrating the work of that health information and technology professional, and just coming together and being a community. That's what keeps me coming back.
Yeah, well, you're the best person to speak for it. Let's talk about kind of first-time attendees to the conference. Speaking to a lot of people feel like, on the one hand, these conferences are the big ones, are, going to something like a HIMSS Global Conference and Exhibition. It's so exhilarating. It's huge. There's so much going on. It's obviously you're able to put on a really good show, but many find it very overwhelming as well. And so what advice would you give to newcomers and attendees on how to best plan for such a massive event, to actually, to get the best experience for their time? What are some tips for best planning practices?
Recognizing you need to plan. So you said it yourself, Mendo. Yeah, absolutely planning. Just showing up and hoping to get where you want to go. That's not the best strategy. I know I've done that some year over year. Incidentally, this will be my 32nd consecutive HIMSS conference that I've been to.
Good
Yes. So, and I even made it to HIMSS 20, but
Wow.
that was canceled. I was on the ground at HIMSS 20. But my advice is plan. What are the goals you want to achieve? Identify 3 goals. So it's very much like a project. What are we trying to do here? What do I want to do here? Do I need to earn a particular type of CE? Do I need, is my organization looking to either add new technology or replace technology? So that's maximizing one's time on the exhibition floor. We do provide tools and resources. We have a mobile app that will be launching in the January timeframe. This is a new mobile app for the HIMSS 25 show, and there will be a majority of tools and resources in the mobile app that can help you navigate. But you really need to identify what are you interested in. So from my perspective, I hold the PMP. So that's Project Management Professional Credential, among others. But that is very project specific, process oriented, implementation focused. So I look for those types of settings. Or those types of sessions in various settings. And what we do with the content, we divide it up into 9 areas. So we have 9 broad themes. So there's care, there's data and information, there's health equity, there's technology, and there's a few others. And within those various areas, there's also topics. So data and information, for example, can focus just on AI and ML, or data science, or cyber. Likewise with care, behavioral health, clinical informatics, and a whole host of other topics. So really identifying the goals that you want to achieve, and then getting familiar with the content and looking at not only those topics that we offer, but then also the audiences. So if you want to have an immersive experience with the IT professionals, you can actually filter. You will be able to filter on content that will bring up all the sessions that are related to an IT professional. We also have personas that are listed on our HIMSSconference.com website. And these personas are journeys. So an attendee can take a look at a various persona to identify really the additional ideas for them to explore this conference.
Can you explain the personas a little more? I didn't fully
understand. So a persona, one of our personas is for the C-suite. So what the likes are, what the challenges are, what the opportunities are, what the type of interests they may have, the CE that they may want to achieve. So it's really just an explanation about a particular grouping of individuals. So nurse is another example, physicians is a third example. So it's a way to categorize attendees.
Got it. Very cool. Let's talk about Vegas in particular. Are you guys in Vegas every year, or do you move around?
So we are in Vegas for 25 and 26.
Okay.
So there's only a handful of venues that can hold the magnitude of a HIMSS Global Conference.
Right.
So Orlando being one, Vegas being another, and Chicago being a third. So we are in Vegas for 25 and 26. Mm-hmm. And really the campus that we're looking at for HIMSS 25, yes, it's the Venetian Expo and Conference Center. Is one of our buildings. Caesars Forum, which is attached to the Venetian Expo Center, is another one. And then the Wynn, which is across the street. So there's that's our campus.
Wow.
You
Quite the
will.
campus.
Yeah, it really is. And that's why when you're planning what your goals are to come to conference, make sure that you think about yourself personally. So, the number one advice that I give to people is hydrate. Make sure that you drink water. Vegas is in the desert and it's dry, and you're indoors and there's air conditioning. So it's very, very dry, but that's pretty typical of a conference facility in general. But Vegas more so because we're in the desert. So hydrate, comfortable shoes, comfortable dress. You know, it's business, professional, casual. So those are some of the tips. You know.
Yeah, I'm also seeing from people online to make sure you go and see some sunlight, because apparently you can go all week without ever seeing the real sky. You just see that.
Yeah. Oh, it's so much fun. Yeah, the shows are great. I remember my last time in Vegas. I was at the Madame Tussauds Wax Museum, and Will Smith and I had a conversation. And he was sitting at a bench, and I was looking as though I was talking with him. And you can find that somewhere in my LinkedIn feed. So I did post that as well. So
Hilarious. Probably the best conversation. He doesn't, you know.
I was, yeah, it was great. Didn't disagree with me at all.
That's so funny. Yeah, well, it sounds really exciting. You know, what's have you been to Vegas? So you're there for 25, 26. I want to ask, were you there? I'm guessing you've been there in the past as well, though, or maybe not.
21.
Okay.
So I believe 17 we were there for sure. 21. So 20 was unfortunately canceled, and then we came back in August of 2021. Very hot, but we were back. And then 22 and 23 were Orlando. I'm sorry. I'm going to stop because I might say it wrong. I can tell you we were in Orlando for 24.
Nice. So do you have any personal Joanne picks for, I don't know, places to meet up, places to eat? What, any Vegas specific things that come to mind? Just between those three properties, there's so much.
I love it all. It is so good. My own, boy, not really. But when grabbing a late night snack or something along that nature, there are, I can't remember, Grand Lux. Grand Lux is my favorite. So they're on the various show floors or casino floors. So they were in Palazzo, and they were also in the Venetian. But it's not an elegant place, but it's really good.
Late night munchies place. Yeah, fair enough. Wow. Well, it sounds like so much fun. I know that registration just opened very recently, a little bit ago. It is open for the HIMSS Global Health Conference and Exhibition. It's going to be in March of 2025 in Vegas. I think it's March 3rd to 3 to 6? 3 to 6, right? Yeah, really exciting.
Thursday, March 3rd to the 6th.
Yep. Where can people find out more about the conference? Where can they sign up? Where can they register? Are there any specials still going on? How can people sign up?
Yeah, so go to the HIMSSconference.com landing page, and you will see the upper right-hand corner a tab for registration. So we have the early bird specials going on now. It's your best bet to register as soon as you know you're going, because folks tend to wait, then they can't register for the pre-conference events they want. Then they call me to help see if I can help get them in. And there's only so much I can do. So my best advice is register now. If you're not registered, that way you get the hotel of your choice. You get the room amenities of your choice. You get those pre-conference, that pre-conference education event that you're looking for. And then you save dollars as well. So HIMSSconference.com is a place to go.
Talk to me a little bit about the UN Sustainability Goals. I've heard just a little bit about it, but give me just a little bit more context.
Sure, happy to. Thank you. So the UN sustainability goals are very, very important in healthcare, very important in many industries, and HIMSS 25 is no different, and a HIMSS Global Conference. So we look at the ways that we can reduce our carbon footprint. So we reduced paper. At HIMSS 24, we went to what was called a full digital takeover, and that was just utilizing the digital signage in Orlando. It was remarkable. It was beautiful. Oh, so incredible. So that's an example of sustainability. The practices that we have with beverage cups and food and things of that nature, but also from a content perspective. So I was able to participate and identify ways that our content also achieves some of the UN goals. This year, I will be focusing on Goal 3 and Goal 10. So Goal 3 is really centered around the health and wellness and those topics that we have at Global Conference that really identify, the health and the well-being of a patient. So virtual reality apps for medical training is an example of that. Another example is an international patient summary that actually follows a patient regardless of what country they're in. So that's a real good example of work that's been ongoing. And then goal number 10, this is reducing inequities. So this is around social determinants of health. And we have a lot of sessions that focus on this. So looking at bridging the digital divide. It's great that you and I have a mobile device in our hands. Not everyone has that. Those that have it, they may not know how to use it. And these are the realities, and these are the things that we try to address. We have another session where we're taking a look at reimagining care for at-risk kids. I mean, who doesn't want to help kids who are at risk? And then Dr. Kate Bastian, the health commissioner for the state of New Jersey, she'll be addressing our attendees in our views session on the public health crisis of today and the future of mental health and addiction treatment. She's a phenomenal speaker. She is as passionate about that topic as I am about education, and she will be a fabulous speaker. So that's a little bit about the focus and emphasis on sustainability at a HIMSS Global Health Conference and Exhibition.
Really fascinating how much really goes into it, and all the thought in building it around a lot of these goals. And I know a lot of your themes are kind of future of this, and we're probably the idea of the conference is to take it from the future to the present. And I saw one of those goals is future of work. What's that theme about?
So there's the talent pipeline issue in healthcare, and you probably can take the talent pipeline issue and insert industry, because we see it in cybersecurity, we see it in project management. And actually, those are two areas that we do collaborate with other organizations. We're collaborating with the Project Management Institute to really elevate the role of project management, since pretty much everything that occurs in a healthcare setting is a project. We also are collaborating with SANS. This has been a multi-year collaboration for us, and we bring cybersecurity training and they bring cybersecurity training and education to our conference. So those are two examples where we supplement to help really lessen the issue with talent development. We're also partnering with an organization called HOSA, which is the Health Occupation Student Association, that goes everywhere from high school to graduate school. And these are the future leaders of healthcare. So at HIMSS 25, we look look to really making sure that we're addressing these opportunities, not only in our content, but in our experiences and on the show floor, et cetera. And one venue that we also try to accomplish that is in our Workforce Connections venue. And that is held one day. And it's an inviting environment for emerging professionals. So those are someone with 0 to 5 years of experience in health information and technology. So it's a student still in school, it's the recent graduate, it's the second career changer, or it could be the third career changer. And I hold the distinction of being a third career changer. So I know what it's about. And we have many of us have worked in the industry and have worked with the content on my staff. So we're creating experiences really to leverage and to welcome that next generation. And in wherever we go, we look at those university settings around us and really invite in that population as well.
Yeah. One of the things that I think I really appreciate about just listening to you and hearing about the way that you, Joanne, as kind of shaping content and programming, really try to capture the entire spectrum of, the professional career from all the way to the beginning to the end. And so kind of moving to the opposite end of the spectrum, I know you also have an executive summit. And that's, so talk to me a little bit about that for the executives.
Sure. So with the HIMSS 25 Executive Summit, this is a program that takes place on Monday. And we have a welcoming reception on Sunday, and then we go into an immersive experience on Monday. And we're really looking at creating a culture of leadership excellence across that healthcare enterprise. And we look at topics such as governance, topics like return on investment and the metrics and the data behind things. We look at leadership and we look at governance. And these things are all critical to the conversation around health information and technology, because it's just not about the CIO. It is not just about that programmer. It's about a whole ecosystem between clinicians and non-clinicians that really deliver strategies and execute tactics to make the patient experience one that is as good as possible. So the Executive Summit is a one-day deep dive into this. We have an advisory board that we do work with, and we're very, very pleased that folks do work with us along with this. And then we also have an experience the rest of the time at conference as well. So we have a Tuesday night event. We also have a lounge where folks can relax and recharge that are part of this experience. So that's an example of someone at the other end. But then there's also a program that HIMSS, the association, creates called the CIO Connect. And this is an immersive 9-month experience for aspiring or rising CIOs. So they have an opportunity to go through really structured programming and education, and then they quote unquote graduate at the HIMSS Global Conference. So we welcomed the CIO originating cohort at HIMSS 24, and we're going to welcome back the next group as well. And it's just really, really satisfying to see that a junior level, if you will, CIO interacting with a senior level. So very rewarding.
It's really exciting. I'm personally excited to be there, and I think it's all about connection. And I think everything that we talked about today, from making sure you plan to the various different aspects that you're going to be able to take advantage of out there, it's all about connection. That's what the conference is. That's what any conference is really about. And I think that, Joanne, you've done a phenomenal job of really cultivating and carefully crafting, a really great environment and programming to really foster those connections. And so everything that I'm hearing from you, from every program that you've mentioned, that's really what it comes down to, is creating a platform for connection, real life, in-person connection between juniors and seniors, between executives and students, between, at all ends of the spectrum, with the common goal of just continuing to heal healthcare and continuing to move towards creating a better system for the patients. That's really what it's all about.
It really, truly is. And it certainly takes a village to do this. I am just one of many working behind the scenes, and we all love what we do. It's, it's a lot of work. It's a lot of long hours, but it's so much fun. And one more funny story. So my daughter, who has since left home, I would come home from a conference and I would say, "Oh man, it was the best conference ever." I come home the next year, "Oh man, that was best." And then, out of the mouth of babes, she would say, "Mom, you said that last year." And I said, "You're right, I did." But it's just so rewarding for all of us who work on such a massive event to go on site and to see the fruits of our labor. And, Mendel, I just thank you so much for your kind words, because it really is a passion for all of us. We love it. And we look to welcome the digital health ecosystem, 30,000 plus strong, to Las Vegas. So thank you for your time.
Absolutely. And Joanne, thank you so much for spending time. Once again, go follow Joanne on LinkedIn. Go sign up for the conference. Registration is open. It is still early. You can still take advantage of an early bird special. And so get out there, go register. And I look forward personally, I think it's going to be an exhilarating experience. I look forward to see you in person, and hopefully many of our listeners. And if you are going to be there, shoot me a message on LinkedIn. Would love to kind of get a crew together. So really looking forward. Joanne, thanks again so much for spending the time.
You're welcome. Thank you. Bye-bye.